Thank you, Mr. President. Mr. President, I come to the floor today.
The Senate is currently in a quorum call.
Thank you, Mr. President. Mr. President, I ask a unanimous consent that the quorum call be vitiated.
Without objection.
Thank you, Mr. President. Mr. President, I come to the floor today, as I have week after week since the President's health care law has been signed, to talk as a doctor, someone who's taken care of patients all around Wyoming, someone who's run the Wyoming health fairs, giving low-cost medical screenings to thousands and thousands of citizens around our state, and someone who knows we needed health care reform in a way that was giving patients the care that they need from the doctor that they want at a cost they can afford. And there were so many promises made with this health care law that I come week after week because there are so many broken promises. And today I wanted to remind the body that former Speaker of the House Nancy Pelosi once predicted that the health care reform, she said, quote, will create 4 million jobs. She said it would create 4 million jobs, 400,000 jobs, she said, almost immediately. Well, it's now 2 years later, Mr. President, and we know that actually the exact opposite is happening. We continue with high unemployment. We continue with people out of work, unemployed, underemployed. And the promise, both from the President of new jobs and of Nancy Pelosi of 4 million jobs, is another broken promise. Instead of creating jobs, this new law is destroying jobs all across the country. They say, how is it that they could actually be destroying jobs? Well, that's exactly what we're seeing as a result of the health care law. Recently, columnist George Will wrote about how the President's law will impact Cook Medical. It's the world's largest family-owned medical devices company. He explained in his column that the Democratic Congress, quote, included in the legislation, and all the people on that side of the aisle voted for this, included in the legislation a 2.3% tax on gross revenue. Not profits, we're talking gross revenue, which generally amounts to about a 15% tax on most manufacturing profits. From U.S. sales of medical devices beginning in 2013. So it's something that's happening very, very soon. This will be piled, as he says, on top of the 35% federal corporate tax plus state and local taxes. Mr. Will went on to say that this 2.3% tax will be a $20 billion blow to an industry that employs more than 400,000 people. And $20 billion is almost double the industry's annual investment in research and development. Well, we want them to do research. We want development. We want new and innovative treatments that will actually help people. Instead, this administration, the Democrats in Congress, in the House and in the Senate, and the President of the United States put a 2.3% tax, $20 billion blow to those who do the research and the development. This tax is going to lead to fewer jobs, but also fewer pain-reducing and life-extending inventions, stents, implantable defibrillators, which all have reduced health care costs in mind. And that's a quote from the article. So Cook Medical isn't the only medical device company that's bracing for the President's new penalty on jobs and innovation. In fact, let's take a look at some of those. Boston Scientific. It's planning for more than $100 million charge against earnings in 2013, and they recently built a $35 million research and development facility. Well, where did they? This is called Boston Scientific. Boston. Where did they build their research center? Ireland. And they're building a $150 million factory. It's called Boston Scientific in China. That's a result of what we see with this health care law and the impact of what this administration is doing to jobs in America. Stryker Corporation, based in Michigan, blames the tax for 1,000 layoffs. Zimmer, based in Indiana, is laying off 450 and taking a $50 million charge against earnings related to this tax. And then these are companies that, as an orthopedic surgeon, have made new advances in technology, in artificial joints over the years that I've practiced in Wyoming, companies that have long-standing reputations and yet laying off people because of the new health care law. American workers. Medtronic. Medtronic expects an annual charge against earnings of $175 million. Other companies now, Covidien, now based in Ireland, has cited the tax in explaining 200 layoffs and a decision to move production to Costa Rica and to Mexico. Once again, the column by Mr. Will makes it clear that the president's health care law is destroying jobs and is having a devastating impact on our economy. In March, Senator Coburn and I released our third health care law oversight report. We entitled the report, Warning, Side Effects, a checkup on the federal health law. One chapter in our report is dedicated to the health care law's job-killing medical device tax. It's a tax that multiple studies and economic analysis predict will negatively impact job creation and also, incredibly important for people around this country, it will stifle medical innovation. As an orthopedic surgeon, I can tell you I have seen firsthand how cutting-edge medical technology, it saves lives, and it also supports jobs across the country. Now, scientists have invented medical devices like pacemakers, defibrillators, artificial joints that have improved the quality of life for so many Americans. But now, today, because of this health care law, the future of the medical device industry in America is under attack. In September of 2011, the Manhattan Institute issued a report showing the devastating impact of the president's device tax on industry. The Manhattan Institute's report shows that the medical device tax will eliminate at least 43,000 American jobs. This number represents more than 1 out of every 10 jobs in the device manufacturing sector. It is not a record that the Democrats should be proud of, but it is clearly a record caused by the other side of the aisle, the Democrats, and specifically the president who signed this bill into law. Not only will this tax kill 43,000 jobs, workers are going to lose about $3.5 billion in wages. This is money that these workers could have spent in their local communities, helping the economy of those communities and therefore the nation's economy. So what does all of this mean to U.S. device manufacturers? Well, these companies are more likely to close their plants in the United States. They will close plants here and do what others have done, replacing them with plants overseas. Foreign manufacturers will improve their competitiveness compared to American firms. This will severely threaten U.S. leadership in the device industry and in the world. Do we really want to see plants closing at high-tech medical device research facilities in states like Massachusetts, Pennsylvania, Minnesota, New Mexico, New York, and Wisconsin? Finally, the president's medical device tax is going to increase costs to American consumers. These are the American consumers who said what they wanted with a health care law is care they need, the doctor that they want, at a price they can afford. Yet this health care law is going to increase costs to American consumers. The Congressional Budget Office, they have warned that the health care law's tax imposed on medical device manufacturers and drug manufacturers and health insurance providers would be passed through to the consumers in the form of higher insurance premiums. Wasn't it the president, though, who promised that under his health care law, insurance premiums would lower by $2,500 a year? Is that a promise that the president has forgotten or Democrats in Congress have forgotten? The American people haven't forgotten, which is why the health care law is even more unpopular today than the day that it was signed into law. The administration's own chief actuary, medical actuary, Richard Foster, he came to the same conclusion. He said that he estimated that these taxes would be passed through to health care consumers in the form of higher drug prices, higher device prices, and higher insurance premiums. If the administration wants to get serious, and I really wonder if this administration wants to get serious, if the administration wants to get serious about reducing regulatory burdens and about creating good jobs, then the president should start today by repealing his onerous medical device tax. Not only will this device tax suppress job creation and limit economic growth, it will also slow and perhaps even stop research and development into new life-saving medical devices. We must take action to repeal this anti-competitive, job-destroying device tax before it begins to take effect in 2013. If the White House wants to work with Republicans on pro-growth policies, policies that support innovation, policies that get the nation's economy moving again, then President Obama would support repealing this device tax. Senator Orrin Hatch has introduced legislation, S-17, that would do just that. I'm proud to be a co-sponsor of that bill, Mr. President, and I believe the Senate should take up the Hatch bill and pass it. But, Mr. President, as we are now 2 years after the passing and signing into law of the President's health care law, I will continue to come to the Senate floor because this is a health care law that is bad for patients. It's bad for providers, the nurses and the doctors who take care of those patients, and it's terrible for the American taxpayers. We need to repeal and replace this broken health care law. Thank you, Mr. President. I yield the floor and suggest the absence of a quorum.
The clerk will call the roll.